Those applications went online yesterday. That's the $40,000 loan for small and medium-sized businesses, $10,000 of which may be forgivable if you pay it all back before December 31st of 2022. It's also interest-free for the first year. So this is for, or directed, according to the federal government, to all of those businesses we've heard from who say, the wage subsidy is a bit of a help, but it doesn't help me with my fixed costs, particularly, for example, paying rent. There are some questions, though, about eligibility for this loan and sort of how it will work going forward. It covers people, with, for example, or businesses rather, with a payroll between $50,000 and $1 million. Is there any sort of loosening of the restrictions coming up around that? Or how strict, I guess, will the restrictions be for so many businesses who are curious to see how this works? I've sort of seen a myriad of responses on Twitter. Some say that it hasn't worked yet for them. Others were approved. They applied very quickly and it was very easy. So like with previous financial aid packages, we'll keep our eye sort of on how the process unfolds and how helpful the measures end up being. But my understanding is the Prime Minister will speak to that. I expect him also, Rosie, to face a number of questions about a piece our colleague JP Tasker wrote overnight that was published on CBC's website this morning, alongside a number of other outlets which have covered a bunch of briefing documents that were tabled in the Health Committee. And those documents are all sort of about giving us a window into what kind of advice political decision makers were getting when they made all the kinds of decisions we've been seeing over the past few months. And the kind of advice I'm referring to is around, for example, what was happening in China, what we knew about the disease, or the virus rather, at the time. How contagious is it? Does it spread from human to human? What those documents revealed, according to our colleague, was, for example, a few months ago, in late January, early February, the government was still getting advice that the evidence showed that human to human, it is not the evidence, that there is no clear evidence, rather, that the virus is easily transmitted between people. We obviously know the case to be different now. They were also getting advice on the ability to quarantine, or the lack of ability to quarantine travelers coming from China, and particularly Hubei province, which is, of course, where this all began, the epicenter of it, saying that it would be too difficult, too much pressure on the health system, the public health system, to quarantine those individuals. They would need to use the Quarantine Act. We know months later they did end up using the Quarantine Act. So I think the documents are helpful, not so much in looking behind and scrutinizing everything that happened, though there is a point in time where that will be necessary, but really for focusing in on how the government makes decisions going forward. There's so many decisions ahead of them when it comes to the public health aspect of this. How do they need to sort of scrutinize the advice they're getting? I'm not saying it's all bad or anything like that, but I think that this does raise questions about sort of the process by which they're making the decisions, the validity of the information coming out of China particularly, and how that process will unfold going forward. So I expect the Prime Minister to be asked about that as well.
Yeah, obviously, you know, some of the questions around sort of these kinds of things so far have been to Dr. Tam, and the answers have been, obviously, this is a new virus. We didn't know much about it. You're quite right. Data coming out of China, that made things more complicated. So yes, there are lots of questions about the advice that was given, and whether this was just an unprecedented time, and so there was really nothing more to do than depend on that advice. I also think he's going to talk about the Easter Bunny, which I know will be critically important to so many of our viewers. I'll leave you there, I'll leave you there, Vashi, for a minute, and turn to not the Easter Bunny, but what Easter is also about, which is churches and religion. And of course, worshippers are still trying to find ways to mark the occasion. The Archbishop of Montreal is holding a special Mass for Palm Sunday that will be broadcast remotely on Skype and YouTube. And Reverend Christian Lépine joins us now. Nice to see you, Reverend.
Nice to be with you. Good day.
So how challenging is this in terms of what you have seen in your time as Archbishop, or in your time in your religious practice?
Well, it's very challenging because we have to reach out to people and help them to pray. Other ways that we would do usually by gathering people together. So it's a constant. Personal prayer is important. Prayer at home is important. But now it becomes more important because the doors of the churches are closed. But the church is not closed, but the doors of the churches are closed, and we invite people to pray at home.
I saw a number of priests gathering at the Notre Dame Basilica in Paris today for Good Friday, and you two are going to do a special service on Sunday online. How important is that, and how challenging will that be to do online?
The services we do are really, we are 2-3 people, no more than that. So it's really like a closed celebration. But with the help of the media, internet, television, YouTube, we register or promote online what we're doing so that people can connect in one way or another.
It is also Passover. Ramadan is just around the corner. I don't know if you have talked to other faith leaders about the challenges of these big celebrations at a time when you are not supposed to be together, and whether you've all given each other any tips or lessons about how to make that work.
Yeah, well, there's like a sadness for people not to be able to go to their church or house of prayer. So there's a sadness, but at the same time, if the idea if we have something good come out of it, then it will be also hope. So in that sense, if we invite people to take their home, it's a corner of prayer in their home, and this way some good comes out of it, and it don't lose touch with God. It might lose touch with the building, but not with God. And the heart of the people still remains open to God.
We have heard from the Prime Minister, obviously, and public health officials about the importance of this weekend. A lot of people will feel the need to gather, to celebrate or to be amongst family. We're seeing people do that now online. But for the people that are still just really wanting to reach out to family at this time, what would your best advice be to them, Reverend?
Well, somehow it might be contrary, but let's say we need to respect distanciations, physical distanciation.
Yes.
But at the same time, we need to be close to each other. So we need to work out a way to get the two together. Physical distanciation must not mean isolations in the sense we're cut off from the world or from others. But it can be linked with whether it's radio, whether it's the phone line, any way that you have at home. Find a way to link yourself to members of your families who are in other homes. Find a way to link yourself to people in the community that you live, mainly if they are alone in their home. So it's somehow, yes, we are conscious that we cannot get physically close to each other, but at the same time, we may become more conscious that we need each other. Because normally often in life, what is daily, we take it for granted. So it's a time to rediscover how the other is important in our life.
What is your message to Catholics or to Canadians of all faith right now as they struggle through what is a challenging time, especially for people who might be vulnerable or living alone?
The fact of solidarity, many people talk about it. I would say everybody talk about it right now, and certainly it is one of the important messages, because the faith leads to solidarity, because we all brothers and sisters in humanity. So faith, even if different faiths, even with non-believers, it all leads to solidarity. I would add maybe something which sometimes we hear. There hasn't been much criticizing of or judging of people to blame someone for the pandemic. So if those thoughts come in your mind, don't let those thoughts win in you. Don't begin the blame game, let's say. It would be, I don't think, it wouldn't help. We need just to think in terms of solidarity and not forget that God is near us, is with us, and doesn't leave us alone.
Archbishop of Montreal, thank you so much for giving us some of your time over this long weekend, and I wish you a happy Easter and a good sermon on Sunday. Thank you so much, sir.
Thank you.
That's Reverend Christian Lepine joining us from Montreal. All right, that was an important interlude because there are so many religious and faith-based holidays happening right now and around the corner, as I said, with Ramadan. And one of the critical pieces of information from public health officials has been, of course, to practice physical distancing, but in the circumstance that you must remain within your immediate family. And your immediate family means, again, just to clarify, people that you live with. So you actually can't go over to your parents' house and celebrate, even if you may want to do that. You can leave a snack on their on their doorway if you want. That's fine, and ring the doorbell. But you'll have to find other ways, virtual ways, as the Archbishop of Montreal is doing, to celebrate some of those religious events that are happening and will continue through the weeks for so many Canadians. All right, let's bring in the host, back in the host of CBC's Power and Politics, Vassy Kapelas. And you know, I do think that, especially at times like this, when people are looking to congregate and celebrate or think and want to be amongst family, whether it be Passover or Easter, it becomes a little bit harder to adhere to the physical distancing. It puts a little more strain on you and your family. But as we've heard from everyone, we are in the early stages of this, and it is really important that we continue, that we sort of buckle down and keep going, even when we are tested, like in moments like this.
Very much so, Rosie. And I think I would even point to our conversation yesterday that followed on the release of all of that data and those projections that were somewhat hard to take, because what they showed us was that these kinds of measures we are just in the beginning of, and that we will likely, we'll certainly actually have to keep them in place until the summer. But the important thing, the sort of underlying factor to all of that was almost a bit of good news, is that so far those measures are beginning to work insofar as it is starting to paint a scenario in this country where the worst case will likely not happen. And by the worst case, I mean tens of thousands of people dying from the virus. And so it is a good reminder to sort of think of that those actions that we're taking right now, as hard as they feel, and especially as counterintuitive as they feel during the holidays, are incredibly necessary to keep us on a path where, although it feels hard, a better case scenario is unfolding.
Yeah, I mean, Dr. Tam said yesterday you could see a tiny, tiny bend in the curve, and if the goal is to plank the curve, as she says so often, to allow for the healthcare to have the capacity to manage whatever cases are out there, then that obviously has to continue. And listen, I get it too. You know, everyone wants to see people and see their friends and hang out, but it is just not what the government and what public health officials want you to do right now. Although apparently the Easter Bunny is allowed into your home, so that I don't know why that is.
There's already
but I'm
a lot
sure
of chocolate in my house. I don't know if I need any more. But
I'm sure we'll hear more. As we wait for the Prime Minister, he'll probably come out in about a minute, Vassy. But just on tomorrow and the House being recalled for the wage subsidy legislation, what are we hearing about that? So
look, this is really important legislation for businesses. It's a really important measure for them that allows them to rehire their employees, because the government will pay 75% of their wages. It needs to be passed in the House of Commons before it can actually roll out. The federal government has said we're looking at anywhere from a 3 to 6 week timeline. So time is of the essence. Businesses are saying even that might be too long. There is some political posturing going on all sides behind the scenes. Parties want other things attached to this. The government has resisted some of that. They have acquiesced on some of that. But what we will see tomorrow as the House resumes is to what degree, what kind of compromise can we see between the political parties, or lack thereof, that gets this thing out the door. I know there'll be a number of MPs here in Ottawa, a reduced contingent, obviously, but our eyes will be on Parliament Hill tomorrow as the House resumes on this Easter weekend to try and get that stuff out the door. Yeah, so unusual, obviously, for them to convene on any Saturday, but particularly on a Saturday of a long weekend, which I don't know what a long weekend is anymore, but it is worth noting that is extremely unusual. And part of the conversation seemed to be around a desire by the government and an examination by the Speaker of the House of Commons to come up with some sort of virtual mechanism so that people, MPs, parliamentarians from around the country can participate in whatever debate or votes or what have you that might be needed going forward if we are in this for a long haul. Obviously, we can't be flying in people from all over the country at all moments. The 20 or so people that come are usually within driving distance, although I know Andrew Scheer, I believe, is again using a government plane to get here tomorrow. So it's really a measure to try and deal with
the fact that Parliament has to continue. The act of what they do in there is extremely important in terms of asking questions of the government and trying to improve legislation. But they are not sure the best way forward for that. And the Conservatives seem quite adamant about some sort of virtual and a physical model. So I don't know if that's what's holding up the negotiations at this stage. I don't know if they're trying to tie all those things together, but it does seem to be an important part of the conversation that's happening behind the scenes too.
Yeah, definitely. That's the ask from the Conservatives. The NDP want additions to the legislation, or at least some sort of address through legislative matters of the issue of people who are left out of the CRB. So you've lost some of your income, most of your income, but not all of it. So everyone's coming at it with certain conceptions of what they want to see. My big question is, how are those conditions of supporting the legislation? We'll find that out, I guess, in the coming hours.
Okay, here is the Prime Minister of Canada on this Good Friday.
Whether you mark Good Friday or Passover, Easter, Tamil New Year, or Vaisakhi, usually this is a time we spend together. You might go to church or to temple or to volunteer. Last year, when I served a community lunch in Hamilton, I saw just how much people come together over these next few days. But right now, this weekend is going to be very different. You'll have to stay home. You'll have to Skype that big family dinner. And the Easter egg hunt, well, it'll have to happen around the house instead of around the neighborhood. I want to take a moment on that to have a word with kids out there. The Easter Bunny has a big job to do this year, and maybe there's something you can do to help. Ask your parents to let you put up a picture in the window to bring some extra chocolate for nurses and doctors. They need a lot of energy to keep us all safe, and this is how you can help them to do their job. Peu importe notre âge,
whatever our age, we all have a role to play to counter coronavirus. Earlier this week, I mentioned that Health Canada had launched a call to volunteers to come and help our frontline workers. And already, more than 27,000 people have registered to help out and give them a bit of respite. From right across this country, there are many of you doing your part, and I want to thank you for that. You're there for each other, and I know that together we will come through this difficult time.
But you don't have to go through them alone. If you've lost your job and are having troubles making ends meet, you can apply for the Canada Emergency Response Benefit. Millions of people have already had their claim processed, and they're getting their $2,000 deposit. Remember, you can apply today or this weekend if you haven't done so yet by going to canada.ca or calling 1-800-959-2041. If you own a small business and are struggling to pay the bills or pay your staff, we launched the Canada Emergency Business Account yesterday. You can now get a $40,000 interest-free loan through your bank or credit union. And if you repay it within 2 years, 25%, up to $10,000 of that loan is forgivable. It'll only take a few days for you to receive the full amount in your account. That's money you can use for whatever you need, whether it's monthly expenses or paying employees. On that note, we're getting closer to implementing the wage subsidy, too. We're working with other parties to get this in place as quickly as possible. Tomorrow, we're bringing back the House of Commons to pass the largest economic measures Canada has seen since World War II. It's really important, despite a time of crisis, in fact, because of a time of crisis, that our institutions remain strong and our democratic principles continue. Therefore, this address to Canadians tomorrow will be a little later and from the floor of the House of Commons. And on that note, I'll be taking Sunday and Monday with Sophie and the kids, but I'll be back Tuesday with more updates on how we're helping you. If you just feel overwhelmed, we'll soon have more to say about how you can access resources that can help. If you're in crisis, reach out, lean on each other, and know that we will get through this together. All across the country, there are stories of people stepping up to do their part. To ensure that Canadians are safe and our frontline workers have the support they need, we're helping companies join in the effort. Look no further than Fluid Energy from Alberta. They will produce over 1 million liters of hand sanitizer each month, with shipments starting as early as next week. We've invested in this large-scale production as part of our plan to have enough vital supplies produced right here at home. When Canadians work together, we get things done.
Last night, I again had a discussion with the Deputy Prime Minister and the Premiers of the provinces and territories. Right from the beginning, we saw a lot of people join Team Canada, including the Premiers. We are all on the same wavelength, and we are all working together to ensure your safety. Over the long weekend, we will all have to remain at home. We cannot have people over for dinner, and we will have to be creative in organizing an egg hunt and staying inside. But not just because we're separated physically doesn't mean we can't lean on each other. You can organize a dinner on FaceTime, and if you can, make a donation to an organization. During the Easter weekend, this will be different than usual. But I know it will be filled with joy, laughter, and love. Thank you, everyone.
Thank you, Prime Minister. We'll now open the floor for questions. Go to the phone line. One question, one follow-up. Operator.
Thank you. Merci. First question, Mike Blanchfield, the Canadian Press. Line is open.
Good morning, Prime Minister. Happy Easter, and whatever else is on your plate. G20 energy ministers are meeting today, as you know, and I'm just wondering what Canada's plan is for playing its role with other countries in the G20 after what OPEC did to cut production and to try to boost oil prices. What's Canada going to be doing?
Canada is part of the discussion, obviously, with the G20 energy ministers. Minister O'Regan is sharing our perspective and the challenges that we're going through in Canada, from Newfoundland to Alberta and Saskatchewan. We're going to continue to work because we recognize that this is a global challenge for many, many different countries, and having a concerted approach is extremely important. We noted what the OPEC countries did yesterday, and I know that's going to be a subject of discussion at the G20 energy meetings conversation today. Okay.
We are part of that conversation with the Energy G20 ministers. Yesterday, we did note what the OPEC countries made as a decision, and those discussions are continuing because Canada is very seriously affected by the oil production issue.
Follow-up.
Prime Minister, so what do you see Canada doing? Do you see it cutting production along with these OPEC countries? If so, what effect would that have in Canada?
As we know, Alberta has already curtailed production and has for some time now. We're going to continue to look to make sure that other countries are doing their part and that people understand that the most important thing through this is to ensure that families and workers across the country and indeed around the world are getting the support they need to get through this crisis safely.
Next question, operator.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir. À vous.
Good morning, Mr. Trudeau. I'd like to come back to the conference call you had with the provinces yesterday. There was consultation about the possibility of invoking the Emergency Measures Act, and I gather this would be to ensure the distribution of PPE across the country. But last week, you said that the provinces could share that equipment and that the provinces had agreed to send that equipment to the provinces that needed it most. So I understand now that the cooperation between the provinces is not going so well. Is that correct? No, I can tell you that the cooperation continues and is improving between the provinces. We really see that this is an historic moment where all the provinces and territories are working together. And when it comes to the Emergency Measures Act, it includes fairly stringent requirements in terms of consultations, and we're we are following that act and looking at the situation in case we have to invoke that legislation. Now, at this time, we do not need it, and we hope we won't need it. But the way our country works is the provinces have emergency measures acts that they have enacted, and if those acts do not suffice, the federal government has its own legislation that can be added on. But for the time being, that is not necessary, and we all hope that it will not be necessary. As a follow-up, this Emergency Measures Act, still with respect to supply problems, could it allow you to centralize the procurement of PPE and increase your buying power in that way? And might that not help us to avoid the problems we're experiencing now? When we're talking about supply, supply is not an issue in terms of the cost or the buying power. The costs are going up. But the reality is that the provinces and the hospitals have their own connections to producers right around the world, and they are using those contacts and connections to secure the equipment they require. In addition, of course, to all the other efforts that are being made right across the country. So it's not a bad thing for everyone to be doing what they can. Of course, we must ensure that we are coordinating our efforts and we're aware of what's working and how things are working. So it really is a coordination effort that we're making at this time, and there is a tremendous amount of cooperation, and that's why we do not need to invoke the Emergency Measures Act at this time. That cooperation is already very strong.
Thank you. Next question, operator.
Thank you. Merci. Next question, Steve Shear, Reuters. Line is open.
Hello, Prime Minister. Good morning. There's a story out today saying that the Bank of Canada Governor Paulos was not asked to extend his mandate, and I was wondering, I know there's a selection process in progress and that it's not over, but ultimately it is the government that decides. I'm just wondering if you think it makes sense for the current governor to stay on a bit longer to help underpin confidence during this crisis. Thank you.
This is an extremely important question because we know the important role that the Bank of Canada has in leading on monetary policy that is an essential part of our handling of this economic crisis related to COVID-19. The government has many fiscal measures, but a strong Bank of Canada is essential in getting us through this as well. And Governor Paulos, as always, has done an extraordinary job and continues to do an extraordinary job. The process is ongoing and decisions haven't been made as to what the next steps are.
We recognize that it's extremely important for the Bank of Canada to be able to play a central role in Canada when it comes to responding to the economic challenge of COVID-19. Governor Paulos is an extraordinary man, and he has always done an excellent job and is showing even more excellence in these times of real challenges. In terms of his successor, no decision has yet been made.
Follow-up, Steve?
Yeah, if I could just follow up, can you give us an idea when that decision might be made?
The discussions and reflections are ongoing.
Thank you. One more question, please, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Good morning, Mr. Trudeau. Just to come back to the Emergency Measures Act, I'm wondering, under what circumstances would you need it? Well, there are various scenarios that we've already discussed with the provinces, whether it's in terms of challenges involving supply of equipment or limiting Canadians' movement even further. So there are various measures that we could theoretically consider, but those measures are not necessary at this time. And for now, the provinces and territories territories can make their own decisions and introduce the measures that they need. The tools that the federal government has right now, such as the Quarantine Act, mean that we hope we won't have to use the Emergency Measures Act, and certainly that would be our preference.
I think there are a number of tools that the Emergencies Act provides for, much stronger controls on distribution of necessary medical supplies and equipment, for example, or further restrictions on travel or on Canadians' freedoms. But as I said, the way our country works is that provinces have Emergencies Act that they can bring in with very strong measures that they have all done. If at one point those measures are insufficient to do the things that are needed to do, and all the tools that the federal government has at its disposal are insufficient to bring forward measures that are deemed necessary, then and only then do we consider the Emergency Measures Act. But as I've said, it is our hope that we don't have to use it ever. We are seeing that the collaboration, the partnership among provinces and territories, and the way we're moving forward on this means that we might not ever have to use the Emergencies Act, and that would be our preference.
Yes, it's been almost a month that your government developed its first measures to address COVID-19, and I'm wondered whether you have already taken some lessons from the last month. Well, in recent months, what we wanted to do was move very, very quickly in order to create new methods and new programs to deliver aid to a huge number of Canadians. Now, certainly our ability to do that was tested in recent months and in these recent weeks. But we have been able to do a great deal to ensure that Canadians this week will be receiving help. But at the same time, we recognize that every time we want to move quickly to help as many people as possible, as quickly as possible, there are always some things that need to be improved, and that's what we're working on now. But I think it does show that our public service is extremely resilient and can deliver in very difficult circumstances for all Canadians, and that will give us greater comfort in terms of being able to bring in additional measures that are appropriate and maybe new as well. But as I say, we've shown that we can respond quickly when the need is there.
I think one of the things we've learned over the past month is that when it needs to, government can move very quickly to help Canadians. We've seen the money from the CERB flow last week into Canadians' bank accounts across the country. That was a monumental task for our public service, for hardworking Canadians across the country who make sure that they are serving Canadians with the best that they have. And I think that lesson that when it's necessary, we can move very, very quickly and nimbly as a government is one that should inform reflections of a government going forward.
From CTV National News. You've said a number of times that testing is an essential way to flatten the curve, and you spoke to Premier Doug Ford yesterday, who has also pushed for more testing in Ontario. But at the same time, we do know that there still remains a number of shortages when it comes to testing kits. How long will it be until every person who needs a test right now is able to get one?
We are continually ramping up our testing. We started earlier than other countries in terms of intensifying our testing programs. Certain jurisdictions are doing extraordinarily well on testing, like Alberta and British Columbia. Quebec is coming a long way very quickly, and Ontario is addressing some of the challenges that they've faced over the coming days. We know there is more to do, but we can certainly know that the lead that we've taken on testing is part of why we are seeing a flatter curve than other places. We've done significantly more tests in total than the United States has, and they're 10 times the size of us. So we know that Canada's testing regime has been good, but absolutely can get better, and we're going to continue to develop more testing kits, faster testing, because we know that even as we get through this first wave of COVID-19, once we are able to get into those coming months where we will be on guard but not as shut down or paused as we are right now, testing rapidly and efficiently of as many people as possible will be a key part of that path forward. Okay. Nous avons fait énormément de progrès en matière de dépistage au cours des dernières semaines. On savait dès le début que dépister le virus était essentiel comme stratégie pour
strategy to limit the spread of COVID-19. Every single day we're improving our testing protocols. British Columbia and Alberta are doing very well when it comes to testing. Quebec has made a lot of progress as well and improved its testing in recent weeks. And Ontario is now addressing some problems with its testing program. So we know that there's more to be done, and we will continue to do more, because that is a critical part of our ability to get through the following year without the kinds of restrictions we're under now, but also having the ability to limit further spread or outbreaks of the virus. We have already tested far more people than in the United States, even though they are 10 times larger than Canada in terms of population, but we know we have to do more, and we will.
Number of announcements about Canadian companies and retooling facilities in order to ramp up domestic production. And you just said in one of your previous answers that the government can move quickly when it needs to. But there are still a number of Canadian companies who say that they can supply this medical equipment, but they're either getting caught in red tape or haven't heard back from provincial or the federal government. So how long will it be until these domestic supplies make it to the front lines and into hospitals?
We've had thousands and thousands of Canadian companies step up and offer to be part of supply chains for essential services, for essential equipment and medications. We are working with all of them as quickly as possible. There have had to be choices as to who we could move quickest with, who was furthest along, but we will continue to work with all companies who put up their hands to be helpful, to figure out ways they can best help. This is something in which all Canadians can pull together and are pulling together, and we will continue to do that.
Hi, Prime Minister. Crystal Oak with Global News. Is the federal government considering any measures, such as regulation or federal oversight, to ensure long-term care facilities are protected from this or future pandemics?
There have been a number of reflections and discussions on this. We've seen that British Columbia has taken strong steps to ensure the safety of long-term care workers and residents. Obviously, this is a point of vulnerability, as we've seen throughout the country in terms of the impact of COVID-19. We're continuing to work with health professionals and medical experts to make sure we're doing everything we can to protect our seniors. Okay.
We recognize that long-term care homes and seniors' homes are a point of vulnerability for spread of COVID-19, and particularly for our seniors and the people who work with them. And that's why we are looking at a number of proposals, including some from British Columbia, to ensure that our seniors are as protected as possible during these tough times.
The number of healthcare workers are contracting the virus. Is that a concern for the federal government, and what is being done to help protect them?
Of course, we are tremendously worried whenever a healthcare professional contracts the virus. That is why providing adequate and significant amounts of personal protective equipment, making sure that protocols are being followed, helping provinces adjust their medical systems in ways that protect our healthcare workers is absolutely essential. We need our healthcare workers not just to stay healthy for their own benefits or the benefits of their families, but we need them to be able to stay healthy for the benefit of our entire community. But we also need them to know that we have their back as they don their protective gear, as they go into battle against this virus for the rest of us. We need to make sure they're getting all the support they need because they are the ones that are going to save Canadians.
We know it is absolutely essential to give all the support and help and equipment possible to our healthcare workers. That's why we're working very hard to give them that equipment and to coordinate our approach with the provinces and working with the provinces and territories as to how they feel they need to protect their healthcare workers and their system. We know that they must be protected not only for themselves and their families in order to protect us, but they have to know that we're there for them. They are the ones on the front lines of this fight, and they are the ones putting themselves at risk to keep us safe. So we have to be there for them, and we have to ensure that they can continue to do the extraordinary work they are doing now for us.
Good morning, Prime Minister. Salima Shivji, CBC News. A briefing note prepared for your Minister of Health on March 10th actually said that the risk of the spread of the virus within Canada remains low at this time. How do you explain the misinterpretation of the threat of the pandemic at such a late stage?
I think we saw that within days we'd begun to take very serious measures to restrict travel, to encourage social distancing. We moved very quickly and earlier than some countries on countering the potential spread of the virus. At those days, the numbers of Canadians infected were still low, but we saw the potential that we are in right now, and we started to act early. And that's why the measures that we're taking right now, the significant measures that we're in right now, are keeping us, we are hopeful, on the best possible curve to get through this in the coming months. Nous avons reconnu que ça commençait à devenir.
We realized that it was becoming more and more serious and that there was a potential for a greater impact across the country. And that's why we acted quickly to limit people's movements and encourage people to practice social and physical distancing. We took significant measures which did ensure that the impact in Canada was slower and not as serious as in other countries, and we will continue to take whatever measures are necessary to ensure there is the least impact and the shortest impact thanks to distancing.
So was that advice that there was a low risk of the spread of this flawed, and what impact did that have on your government's work to contain the virus?
Our work continued every step of the way, informed by the recommendations made by our health officials. We wanted to both make sure that there were no panics on Canadians, while at the same time getting people to take more and more significant measures, because we knew that the behavior of Canadians was the strongest way of doing what we've been able to do so far, which is slow the spread of the virus, delay it beyond where it's been in other countries, and give us the best possible chance of getting through it. As we look back, of course, there's going to be things we said, oh, we might have said this differently or that differently. There's going to be an awful lot of learning through this. But it remains that as we get through this now, as we live through the measures that we've put in place and lean on each other and hold together, we have the best chance of getting through this in the coming weeks and months by remaining true to the advice that experts are giving us, to stay home, to keep 2 meters apart, to wash our hands regularly, to not go outside unless we absolutely have to hunker down, lean on each other virtually and metaphorically, and be able to support each other through this time.
We recognize that, of course, we may think we should have done this or should have done something different, but the reality is that we took measures quickly that ensured that the spread of the virus would not be as serious as in other countries. We are still on a path that should allow us to come out of this pandemic more quickly than other countries, but we must continue along along the path that is in place now. Stay at home, maintain the right distance, and not go out unless we need to. Wash our hands frequently. These are the things that will ensure that we can get through this as best as possible and rebound economically and as a society as quickly as possible. Now, with respect to the economic impact, now the Premier of Quebec was saying that some economic sectors will be able to start up soon. But you're saying it's going to be a year or a year and a half before we get back to normal. Do you believe that there are some economic sectors that can start up sooner, and if so, which ones? Well, we cannot talk to a return to normality unless there is a vaccine or until there's a vaccine against COVID-19. However, there will be some relaxation of restrictions once we have come through this first wave of contagion. In our models, we can see that that relaxation could possibly start this summer. But even in the fall, we will have to live with certain measures or restrictions to keep us safe and minimize the risk of a resurgence of COVID-19, which means that we will not go back to normality, to the previous situation before COVID-19, unless or until there's a vaccine against the virus. But there are various sectors of the economy and certain economic activities that can start up again once we've completed this first wave. And we are currently discussing that with the provinces and the industries and healthcare experts and our scientists, so that we can determine where and how we should relax the restrictions and how to do it gradually. So I agree with Mr. Legault that we should be able to do that in the weeks and months to come. But we have to reflect very carefully and in full coordination with others as to how that can happen. I think it may have been a little discouraging yesterday to hear you say it would take a year or a year and a half before we return to normal. Could you be more specific and perhaps talk about which sectors could start up again? You're talking about measures that could be in place for a year or a year and a half. In concrete terms, what are you talking about so that people can know what to expect in the coming months? We are currently in the first phase of the virus. We are dealing with the spread of this virus right across our society, concentrated in certain regions, but we are all vulnerable to COVID-19 at this time. So we are taking steps now to ensure that people stay home in order that people don't go to work unless they have to ensure that people don't go out unless they absolutely need to. And people are fully aware of the situation we're dealing with now. We basically have paused our economy and paused our normal life as Canadians. And we will have to continue to do that until we come through this first wave of COVID-19 that should be the most serious. Now, once we've come through this first wave, we will be in a place where we can relax certain rules. More people perhaps can go to work. Maybe schools can start to open again. Some economic activity can begin. But this will have to be done in such a way as to minimize the risk of further outbreaks of COVID-19. At that time, we will have developed much better testing protocols, for example. We will have the technical and technological ability to follow or do the contact tracing of those who have been infected. We will be in a much better position at that point to limit further peaks of the spread. And it won't be normality as we knew it before, but we will be able to do a great many things that we cannot do right now, even though we'd like to. But there will be ongoing vigilance until we have a vaccine that's distributed to everyone, and we don't know when that will be. It could take 6 months, it could take a year or a year and a half. We don't know how much time that will take. But in the meantime, our researchers are working on that very hard. But what we do know is that our ability to ensure that this first wave of contagion finishes this summer depends entirely on us, on the citizens of this country, on people continuing to stay home, on people continuing to maintain their distance, on continuing to do what we're doing now for a number of weeks. And then possibly we can, and I hope to be able to talk about relaxing the current rules in the summer.
What we are in right now is the first phase of the spread of the virus. This is the phase that runs to a certain extent unchecked or difficultly checked through our society, through our communities. We're seeing new cases pop up here and there. We're seeing people struggle to handle it and to keep these measures from overwhelming our healthcare system. If we do things right, this will be the first and worst phase that we go through as a country in terms of COVID-19. If we keep these measures, these strong measures in place of staying home, of not going outside unless we absolutely have to, on keeping 2 meters apart, in being strong about social distancing, these are the things that will ensure that we will get through this first wave of the virus as quickly as possible with minimal loss of life as well. This is what we're looking for, of not overwhelming our healthcare system. And that happens if we stay strong about remaining at home for the coming weeks. According to the models we've put forward, it is possible that we will be able to be out of that wave this summer. And at that point, we will be able to talk about loosening up some of the rules that are in place, looking at particular sectors where people can go back to work, bringing in new rules around how people can interact with each other in society and get things rolling again. We'll have to be very careful about how we do that, and we will have to remain vigilant and active every single day for possible resurgences of the virus. At that point, however, we will have developed much better testing protocols because every single day we're improving them. We will develop new technologies for contact tracing, and we will all become much better at reacting when a possible resurgence happens. So as we look at possible resurgences over the coming months, we will be better adjusted and adapted as a society to minimize them and therefore minimize the disruption to everyday life, to our economic activity. That is the ideal scenario. But it only happens if we continue to stay strong for the coming weeks and stay, inside, keep those 2 meters apart, and be very careful about not allowing COVID-19 to spread further. That phase of vigilance, of easing off to a certain extent, but still being careful, will continue until such a time as we have a vaccine for the virus. Researchers across Canada and around the world are working hard on this. It could take as little as 6 months. More likely it'll take a year or a year and a half, maybe even longer, but I know the best minds are working on that. So we will, once we're through this first phase, be able to get back to something that is more normal, but we will not get back to the normal that we had before, at least until we have developed a vaccine for the virus. That is the reality, but the fundamental bottom line that people can reflect on this weekend is if we stay strong in our social distancing measures now and for the coming weeks, we can see how things can start getting back to normal in the coming months, and we will be able to get through this, because that's what Canadians do. We lean on each other, we support each other, and we figure out how to get through the big challenges that life throws at us. Merci beaucoup tout le monde. Have a wonderful Easter.
All right, that is the Prime Minister of Canada with his daily update on the pandemic, on COVID-19. Just out of interest, that is the 26th briefing in a row that he has given outside of his home there, Rideau Cottage. But he does say tomorrow he will not do a briefing. He will be inside the House of Commons for that critical debate around the wage subsidy legislation. And then he'll take a couple of days off with his family, both Sunday and Monday. Got a fair number of questions there about some of the reporting that has been done by my colleagues. So I'll bring in the host of Power and Politics, Vashi Kapelis, to go through a bit of that as we wait for the federal cabinet ministers and public health officials there. All right, let's start with the Emergencies Act, because as that was happening, our colleagues published their story that they've been working on through the night. That sort of gave us a sense of the phone call last night between the Prime Minister and the Premiers. And it certainly seems as though the Prime Minister is not interested in using the Emergencies Act yet either, Vashi.
No, definitely from the comments that he gave today, it doesn't seem like the interest is there. Our colleagues reported on that call between the premiers and the Prime Minister yesterday, and the bottom line was the premiers, for the most part, don't want the Prime Minister to invoke that, don't want the federal government to invoke the Emergencies Act. There were a couple bits and pieces, though, that I found really interesting on the Act and the application of it from the Prime Minister. First of all, he was very specific about what he saw as its use, and we had heard iterations of this from the Health Minister previously, but mainly for stronger controls on necessary medical supplies, the distribution of those supplies. So we're talking about, for example, personal protective equipment. If there are certain hotspots, does the federal government need to intervene in order to make sure that equipment is moved from, let's say, one province that doesn't need it as much to another? And the second would be for further restrictions on travel. No specificity as to what those restrictions would be, but that would be the general application of invoking the Act. On that, the Prime Minister, again, like you said, was very clear. The provinces, he says, are working together right now very well. They continue to do so. He doesn't at this point see the use of the Emergencies Act, the need rather for the use of it, and he said they might not ever have to use it, and that would be our preference. So pretty clear statement from the Prime Minister where the Emergencies Act is concerned. It doesn't sound like it's going to be used anytime soon. However, what our colleagues have been reporting on is letters went out to the provinces. It's been brought up in various conversations. Some premiers more than others not happy that it's being raised at all. For example, Saskatchewan Premier Scott Moe, as well as BC's Premier John Horgan, both don't see the point of having that in the conversation. In any event, my understanding from people I talked to in the federal government is this is sort of a precursor to the actual it would be a precursor rather to the invocation of the Act. So they're getting ready for the possibility they may have to use it. That doesn't make it untrue that they don't want to use it. They're just sort of going through the checklist before having
just in
to
case.
do so.
Yeah, that's right. As we're running out of time, I just want to ask, get you to summarize how you took the questions around. Again, JP Tasker's reporting about some of the advice that was given to the government by public health officials, and the Prime Minister was basically asked by our colleague Salima Shivji whether some of that advice was maybe not the greatest. And I'll get you to sort of brief us on what you took from
and
that.
she zeroed in on the one most interesting piece, well, part of the most interesting piece from a briefing note for the Health Minister back on January 19th, which told her, based on the latest information that we have, there is no clear evidence that the virus is easily transmitted between people. We, of course, know now that not to be true. The Prime Minister sort of didn't directly address that specific claim and the validity of it, but said that they have now done the proper thing. They have acted in an adequate measure. I'm paraphrasing here, and he sees evidence of that in sort of what we heard from Dr. Tammer on the projections yesterday. Echoing what we've heard from him in the past, not so much of a desire to look back on the decision-making process that has already happened and rather focus on what's happening now. I'm not sure that will allay concerns from the opposition.
Yeah, he also said that the decisions they made were informed by health officials, which is obviously the advice that they were given there. And he said they also wanted to make sure there was no panic amongst Canadians. So I'm sure there'll be further questions about those things and more. The Prime Minister also giving us some clarity around this new normal, saying things will ease off once we start to get a handle on things, but not really until there's a vaccine. We will leave you now on CBC Television. If you want to continue watching the Federal Briefing, CBC News Network, CBC.ca. I'm Rosemary Barton. Thank you for watching. Hello again, I'm Rosemary Barton, live in Ottawa as we stand by to bring you the briefing, the federal briefing from cabinet ministers and federal public health officials. Thanks for joining us on CBC News Network on this holiday Good Friday. We are also streaming live around the world on the CBC News app and CBCNews.ca. Just moments ago, the Prime Minister said there are no plans at this stage to invoke the Emergency Measures Act, especially after a conversation with premiers yesterday. He also says he hopes he never has to use it, and that is because he says the cooperation between Ottawa and the provinces remains strong during this pandemic. Justin Trudeau says his daily address to Canadians tomorrow will in fact be from the floor of the House of Commons, the Commons and the Senate, being recalled for a rare holiday weekend to talk about the emergency wage subsidy program. And then the Prime Minister says he's going to take a couple days off with his family. All right, as we wait for that briefing from federal officials, I want to go to my next guest. It is Dr. Nadia Alam, who's on the front lines during this pandemic. She's an on-call anesthesiologist and is treating COVID-19 patients. Nadia joins us live from Georgetown, Ontario. Doctor, nice to see you.
Thank you very much for having me on the show.
Anesthesiologist. It's hard to say a couple of times. Listen, I wanted to get you on the show because of a tweet you sent out last night that caught my eye, and I have to say made my heart sort of twinge a little bit too. This is a picture of you in your gear after a very long shift. Can you tell us a little bit about what happened last night?
So, like the other GP anesthetists and like other anesthesiologists around the province, I was on call and working in the OR, going to stat intubations, putting patients on life support, that sort of thing yesterday. It was a 24-hour shift. I was in the hospital for about 10 hours. It was a very long day, I have to admit. But it's good work, it's important work, and this one patient stole my heart, and that's in that moment of desperation and sadness and hope, I tweeted, and I'm surprised by the response to that tweet.
So you were coming off this very long shift, doing very hard work, and this older gentleman, he asked you for what? Well, how did he capture your heart?
So I was called in to intubate him. He's an elderly gentleman. He's got poor lung function. He's got COPD and a number of other illnesses that make him quite frail. He'd been brought into the hospital because he needed extra supportive care, so supplemental oxygen to help keep him stable and keep him well until he could recover from COVID-19. There is no cure for COVID-19. The reason I was called was he was worsening. He was getting sicker. If he wasn't put on a ventilator, it wasn't clear whether he would survive or not. Now, I want to be clear, being on a ventilator is not a cure for COVID-19 either. So I geared up, went in to intubate him and put him on life support. And as we spoke, as I got his consent, he realized that there was a high chance that he would end up passing away. He would end up dying on the ventilator. And that is not how he wanted to go. That was not how he saw all of this playing out.
So you sat with him for a little while.
Yes, he turned to me and said, if I die from this, I would rather die looking at the sky. I would rather die talking to my family. And so I sat with him and we looked at the sky, and it was a beautiful sunny day. And we talked about his family, and he put his family on the phone so that I could talk to them too. And like I said, yesterday was a hard day, but that time with him was probably the most peaceful moment that I had.
And did he end up going on the ventilator, or he decided he just didn't want to go down that road at all?
No, he told me he didn't want the tube. I went back to see him again this morning. He's sicker this morning. And we talked again, and he still understands all of the risks. He's made an informed decision. He realizes that he's had a really good life. He realizes that he's very seriously ill. He knows that he could pass away from this, but he wants to go out on his own terms. And so that's what we're giving him.
So how are you doing in the midst of this? You know, this is one story, but you're seeing many, many stories right now.
Yep. This morning, after I spoke to him, after I saw him, I went on a couple of house calls. One of my patients, she's elderly. She's also very frail. I apologize. My kids are in the background.
No, it's all good. We're all dealing with it. Don't worry.
She's very frail. She's disabled. She's essentially bedbound. And I went in to see her because her husband called me. He's her primary caregiver. He's working really hard to take care of her and keep her safe, keep her at home. Everybody's very careful around her. But she started having a fever this morning. She started having a sore throat this morning. And I went in to see her because I was worried that she might actually be developing COVID-19. Patients who are elderly and who are frail or who are complex, she's on immunosuppressants, they don't present with the usual fever, cough, shortness of breath. They present in other ways. They could present with falls. They could present with hallucinations. They could present with weakness. They could present with sore throats. So now we're watching and waiting. I love this family. I'm very nervous that if it is COVID-19, it's not going to look very good.
You know, like so many healthcare workers, I asked you sort of how you were doing, and like many frontline workers, you started talking about patients, and I know that's sort of the way you guys are trained. But I hear the kids in the background. I know you're putting yourself at risk every day. How are you doing? How worried are you about your own health and your kids?
I'm scared. I read an article today about a physician who had urged his country to provide proper PPE, personal protective equipment, for frontline healthcare workers, and he passed away. So I know that the work I do, it is incredibly important. I love it. I love being a doctor. There is no doubt about that. I have never understood this more clearly than in these days. But I'm scared. I'm scared because I'm afraid of catching the disease. I'm afraid of passing it on to my more vulnerable patients. And I'm afraid of being one of the statistics that passes away from it. I have to admit that. I am afraid. And my kids, they feel it too. A couple of days ago, my 6-year-old turned to me and hugged me and said, "Please don't die." And that was really hard, talking to him and making him understand that I'm young and healthy. I'm probably going to be fine. And he was like, "But you talked about other people who were young and healthy who passed away." And I had no answer for that. So all I did was hug him. I just sat there holding him until he stopped being afraid for a little while. We're all trying. We're all trying very hard, but these are not easy times.
No, they are not. About personal protective equipment, I saw last night in the photo you seem to have what you need, but do you need more? Are you concerned about that part of it?
We don't have enough. My hospital has enough for now. We don't know when the next supply is going to be coming. We don't know where it's going to be coming from. So there's an incredible amount of uncertainty around it. There are some hospitals that are at imminent risk of running out. We are all saving our used masks in the hopes that Ontario Health will be able to figure out a way to reprocess them, resanitize them so that we can continue using them. In the communities, it's even worse. So I not only do anesthesia at the hospital, I'm a family doctor in the community. That's why I was doing house calls this morning. So I do everything from cradle to the grave care. A lot of my colleagues have no PPE left. And that's why some of us, like me, are running community drives, trying to get masks from nail salons, gloves from factories, gowns from people who are at home who can sew us reusable cloth gowns. We're trying to get enough PPE going. And my hope is, and this is kind of my plea to the government, to all levels of government. I know you're working hard to get us the personal protective equipment that we need to be able to do our jobs properly. I know that you're focused on the hospitals. Please don't forget the communities, because that is where we take care of our pregnant patients. That is where we take care of little kids. That is where I take care of my patients with heart failure and cancer, for pain control. That is where I take care of my palliative patients. Please don't forget the communities.
I've got a briefing that I have to get to, but let me ask you one last question. What would you say to Canadians? You know, we're being told we're in the beginning of this. We've got to buckle down for many more weeks. What would you tell Canadians?
Keep faith. This is working. The social distancing you're doing, the hand washing, being careful, it's making a difference. Please continue it. I know it's hard. A lot of people have lost their jobs. A lot of people are struggling from just the isolation, the mental challenges of being stuck at home by themselves. I've had patients who've broken down on the phone about it with me, but it's worth it. It is helping. Please stay safe and keep faith.
Well, Doctor, same to you. Stay safe, keep faith. I knew when I saw that tweet last night that you would be more than good to talk to, and thank you for being so honest and so personal. And listen, I wish you lots of courage going forward. Thank you.
Thank you.
Dr. Nadia Alam in Georgetown, Ontario. All right, let's bring you now to that briefing with federal cabinet ministers and public health officials. We're coming in a little late because I did want to finish that conversation with the doctor. Here is Minister Carla Qualtrough.
I want to be clear. Our priority is to ensure that Canadians who are eligible can access it in the quickest and most simple way possible.
A simple system that could automatically process claims in a straightforward way and deliver money to Canadians quickly. To do this, we put most of the integrity measures at the back end. We're delivering a single benefit to Canadians who are EI eligible and non-EI eligible. If you are eligible for EI and apply, you'll be receiving the CERB. If you are not eligible for EI and apply, you will be receiving the CERB. The only difference is in how we process these claims. This benefit is jointly delivered by Service Canada and the CRA. If you are eligible for EI, we will process you through Service Canada. If you're not eligible for EI, we'll process you through the Canada Revenue Agency. Online, regardless, all Canadians apply at www.canada.ca/coronavirus-CERB. From there, our system asks a few simple questions to make sure you go through the right side of the system. And we're asking Canadians to do their part by following the process and honestly answering the questions on your screen. Now, we know that some Canadians may have been worried that they applied for EI but not the CERB, so they ended up applying twice. This means that some Canadians may have received 2 payments. Don't worry, it's fine, we're on it, we're sorting it out. CRA and Service Canada are working together to ensure that these situations are reconciled and payments do not exceed the maximum amount allowed per individual of $8,000 over a 16-week period. We'll be in touch with Canadians that have received 2 payments of $2,000 with details on next steps. You don't need to contact the call center. I repeat, you don't need to reach out to us at this time. But we are reminding Canadians that you are eligible for a maximum amount of $8,000 over 16 weeks, meaning if you got an additional extra payment this month, you must budget accordingly. Some Canadians who are eligible for EI could have also received additional funds, however, not a double payment of $2,000. In these cases, these are other entitlements which you previously qualified for, but were paid out at the same time as you got your CERB when you were automatically enrolled through Service Canada. In these cases, you don't need to worry. There is nothing for you to do.
I want to repeat that if you've already made an EI claim, Since March 15th, you will also be automatically eligible for the CRB, and you do not need to file another claim. If you have any questions, I encourage you to go check the website to learn more. We continue to work around the clock to ensure that Canadians get the support they need during this critical period. Thank you.
Merci beaucoup, Carla.
Thank you very much, Carla. And now I'll give the floor to Mark Miller, Minister of...
I would like to begin first by acknowledging that we are gathered on the traditional territory of the Algonquin people. Good afternoon, everyone. Long-standing social and economic inequalities mean Indigenous communities could be disproportionately affected by COVID-19. During this pandemic, my sole priority is the health and safety of the Indigenous peoples in Canada. As such, we are focused on the public health response that will save lives. The transfer of $305 million in funds to support Indigenous communities and organizations across Canada has begun. The funding will address immediate needs and to help Indigenous communities prepare for and react to the spread of the virus. We know that each community, each nation, has its own unique needs, and the Indigenous Community Support Fund is designed to give the maximum flexibility to address them. While the majority of those funds are flowing directly to communities, $15 million will go towards Indigenous organizations providing services to Indigenous peoples in urban centres and those living off reserve. As announced on Monday, these organizations are invited to submit their applications online now. I do readily acknowledge that these funds may not be sufficient. We continue
to work with Indigenous communities and partners in the provinces and territories to ensure that the necessary resources such as PPE, including hand sanitizers and other disinfectants, are ready to try to stem the propagation of COVID-19. In cooperation with communities, we will continue to further plans and provide staff on the ground, such as medical staff, as the situation evolves. We also have provided recommendations and protocols to support communities, and these were translated into many Indigenous languages. This content includes protocols for self-monitoring for healthcare workers in the communities, as well as directives on social distancing, especially for vulnerable peoples. These are directives that must be followed. So far, we have sent on expedited 410 requests for material. And in terms of the healthcare centers and other testing facilities in the various groups, people have what they need, and we are working as hard as we can to obtain further testing kits to be able to provide them to rural and remote Indigenous communities based on needs. As of April 9, there are 40 confirmed cases in the First Nations communities on reserves and 5 cases in Inuit communities in Nunavut.
Confirmed cases of COVID-19 on reserve and 5 in Nunavut. Through this time, we are seeing great leadership in action as communities are taking strong and necessary and innovative measures to prevent the spread of the virus. For example, the At Home on the Land initiative to help Indigenous families in the Northwest Territories move onto the land where they can maintain safer physical distances than if they were to remain in their home communities. Some communities are adapting community spaces to support self-isolation measures. Other communities have ordered ready-to-move structure trailers in order to have additional space available. For communities that require alternative health infrastructure and resources, we are exploring all options with our partners to best meet communities' need. We are actively getting resources out the door and stand ready to deploy additional resources. I recognize the concerns about capacity and resources, in particular in remote and fly-in communities. And I'd note we are actively working to expand nursing contracts and assessing the need for other health professionals such as paramedics and first-line responders to help emergency responses. We've also recommended First Nations with upcoming elections not to proceed with elections at this time as a result of the current associated public health risks. We've introduced a temporary regulatory option, the First Nations election cancellation and postponement regulations that will allow First Nations leaders to continue exercising their roles and duties within their communities for up to 6 months, with a potential extension as leaders focus on preventing the spread of COVID-19 for the next year. The decision of whether to hold scheduled elections in the current context of the spread of COVID-19 remains with First Nations. In addition, I recognize that this unprecedented situation can place unprecedented financial burden on Indigenous families, especially the most vulnerable. The Indigenous Services Canada Income Assistance Program provides funding to allow First Nations to match rates and eligibility of their province of residence. As a result of this program, BC First Nations will receive $300 per month per adult, as was announced by the Government of BC for current income assistant clients living on reserve. We've seen a lot of positive measures taken by Indigenous communities to protect their populations. I want to recognize again their important work and the strength that they have shown. But let me be clear, this is just the beginning. We know more support will be needed, and we will be there to make sure no Indigenous community is left behind. By working together, we can save lives. To those in isolation, I want to assure you that you are not alone. Canada will be with you every step of the way. Miigwech, Nakumik, merci, merci, thank you, Tonika Wanage.
Thank you, Mark, and we will now be pleased to answer any questions.
Okay, so as usual, we'll start with 3 questions on the phone before turning to the room. 1 question, 1 follow-up. Operator?
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, notre première question est de Marie Vastel avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour. Ma première question pour
Question. Yes, my first question is for Mr. Duclos, if possible. I want to come back to the unemployment numbers we saw yesterday. Huge numbers. We also read your own prognostics, your own modeling, looking at a pandemic that could go on till next year. Now, we're clearly in a recession already. Is it possible that we could fall into a depression? And if that's the case, we're already over $100 billion in assistance for Canadians in the provinces over the next 4 months. $300 billion, that's what it would take until next year. Is that what you're looking at? Answer. First, I'll give the floor to Ms. Carla Qualtrough, Minister Carla Qualtrough, for the unemployment numbers. But let's be clear, Canada is going through an emergency situation that we've never seen before over the past many generations in terms of health and the economy. And that's why Prime Minister Trudeau was very clear. We're going to do everything to make sure the families and workers have what they need to make it through. If we didn't want to do that, we would end up with a huge social crisis in Canada. We also took rapid measures to secure our country in terms of what's happening socially. That is, ensuring that employers have the means to pay their workers and to retain them through the wage subsidy. We are lucky in our fiscal capacity in Canada compared to the other G7 countries, and Prime Minister Trudeau said it very clearly. We will continue to use this tax capacity and this fiscal capacity to intervene and support as long as is necessary. Carla? Yesterday we announced that there's about 1 million jobs that were lost. As Mr. Duclos said, we do have the tax and the fiscal capacity. We are quite lucky to have that capacity. We understand that our measures are in place for the 16 weeks, and the Prime Minister and the Cabinet has started looking at whether this needs to be extended further. All options are on the table. We continue to assess the situation, and if we do need to go further, we do have the ability to do so, but we are quite conscious of the amount of money this is taking. So this is a very serious decision that the Cabinet must take.
OK, mais est-ce que c'est
Follow-up question.
vraiment sur la table de
But is it really on the table to continue with that, with those support measures at the same scale? Ms. Qualtrough, you said yourself that you're aware of how much this is costing. I mean, among those options that are all on the table, is it possible to maintain this support at the same level? Answer, absolutely. Absolutely, that's on the table. But we haven't made that decision. We're not there yet. We don't know how the situation will evolve. This really depends on Canadians' actions. That is how long the pandemic will last. We continue to assess the situation day to day, and everything is on the table.
Merci. Prochaine question, s'il vous plaît.
Thank you. Next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Althea Raj with the Huffington Post. Please go ahead. À vous la parole.
Good morning. I hope you all have a lovely Easter weekend, and thank you for taking my question. My first question, I think, is better placed for Monsieur Duclos. I'm hearing, it's a bit specific, I'm hearing about this, so I assume that there are other cases across the country, but I was contacted last night by a man who was told by his employer that everyone in the office will have to take a 25% pay cut because the federal government is only paying 75% of wages. And for context, nobody at this company has been laid off yet. They're considered an essential service. So I'm wondering what your reaction is to this, and might you have a message for employers who are doing this and employees who are being told this? Thanks.
Well, thank you very much for the question. And we all hear from your question that we all have a responsibility to go through this crisis. The federal government clearly has an important role to play, and it has been demonstrated over the last few weeks to act in an emergency manner in a way which is making the lives of millions of Canadians sustainable when it comes to meeting ends meet. We also expect, and we have I think communicated that clearly to all business leaders across Canada. We also expect businesses to do their own work, to meet their own responsibility, and we do this in a variety of ways. And one manner which is certainly very strong and I think much appreciated is through the 75% wage subsidy. Now that wage subsidy is targeted to those employers who would and who are experiencing an important fall in their revenue, in their income, and precisions have been brought on that particular program by the Minister of Finance just a few days ago. That's 75% paid by the federal government. However, we do hope, and in some cases would expect, that employers would add another 25% so that full wages would be paid. But we are understanding that not all businesses will be able to fill the gap between the 75% and the 100%. Now, for those other businesses that are not currently struggling, that sometimes in some cases are even invited and or even adding to their business activities because of particular circumstances, and we would understand and would certainly expect those businesses to maintain their workers and to pay them at the level which would normally be the right level, because in those cases businesses would be going through circumstances very different from the circumstances of other businesses that are currently being very challenged.
Althea, follow-up?
Thank you. So as a follow-up, and I'm going to ask this to Minister Qualtrough, if you want to weigh in, please go ahead. Because to be fair to this employer, I do think their sales have declined, but the idea that, when you're seeing people in your own family get laid off and then you're just told that your salary is going to be cut by a quarter because Ottawa is not paying your full wage, as if Ottawa was paying your wage last month. I think that can come as quite a shock. But I also want to ask about the CERB. There was a report in the Star yesterday that anyone who applies for CERB is basically being given CERB. So is the message to Canadians who now are have fallen through those cracks that currently exist, self-employed Canadians, those with reduced work hours, basically anyone in need of financial help, is the government basically saying apply to CERB, use it as an interest-free loan and pay it back next year if you don't specifically qualify for CERB, instead of waiting for the government to come forward with a program that helps these people specifically?
We'll turn to Carla for an answer to that question.
Thank you. I'll answer your second question first, Althea. So the CERB was by design created as a simple, straightforward, automatic process. We built integrity measures in at the beginning, like social insurance number verification, but there's also integrity measures built in at the end and during the process at our back end. So we know, for example, how to verify if someone had income or didn't have income. And I hear you, but we also know how very honest Canadians are. And the trade-off would have been to build these integrity measures. So show me your ROE, prove your income, and it would have taken months to deliver this to that many millions of Canadians. So on the one hand, the integrity measures are straightforward at the beginning, but we will, whether it be in the upcoming weeks or at tax time next year, reconcile accounts and make sure people didn't game the system or fraudulently claim something that wasn't true.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Micheline Laflamme avec Radio-Canada. Please go ahead.
Micheline Laflamme, you have the floor. Question. Yes, hello. Thank you very much. I was wondering whether you obtained guarantees from all opposition parties to ensure that the wage subsidy program would be adopted without a hitch tomorrow, if you'd have to be around for a few days again. Answer, if I may. I think that all parties, whether in government or in the opposition, understand how urgent the situation is. All parties worked together over the past few days to ensure that this significant program, the largest measures in Canada's history, can be voted on quickly and voted through quickly by Parliament, by the House of Commons. We understand, and as the leader of the House understands best, there have been all kinds of discussions over the past few days, but the House leader of the Government of Canada and the leaders in the House of the opposition parties are doing everything they can to ensure that this program can be passed as quickly as possible over the next few days by Parliament. Follow-up question. Now, after this isolation period, I'm wondering what would be an acceptable level of community transmission that would allow authorities to say, now we can take our foot off the brakes a little bit? Is it 0%, 5%, 25% of community transmission? Answer, once again, this is something that is better answered by Dr. New, since it's public health. I'll give him the floor. Answer. Thank you. As we said during our modeling briefing, well, it will really depend. Everybody is doing their best right now. All Canadians are doing their best. And it's something we have to keep an eye on. Perhaps 1% of the population will be infected during the entire pandemic in Canada. It will last a few months at least for the first wave, and then we don't know what will happen for the smaller waves later on. So we need to be monitoring the data. At the beginning of the epidemic curve, we don't know when the peak will be because, as we said, it's only in retrospect that we can really see whether we are on the descending portion of the wave. And then we can see, oh, we're past the peak. For now, that's the key message we want to send out. Everybody has to do their part. All Canadians must continue with their public health measures, that is physical distancing and so on. We hope that we'll get good results from that.
Thank you, Dr. We'll now turn to the room, starting with our friend Mike from Global. Oh. You've been so patient, Mike.
Sorry. Okay. Is this on? Okay, cool. What percentage of the positive COVID cases are being contact traced right now? And how important is that tracing to getting these restrictive measures removed or reduced or getting us back to normal?
Dr. Tam?
So I know that within across Canada, all the provinces and territories are doing contact tracing on the cases. At the same time as we're asking people who have any kind of symptoms to stay at home, and of course observe self-isolation as directed from public health. So that is a very key part of the current response. But we know that this virus is a very difficult virus to ascertain who might be infected or not. So this is why these social distancing measures and staying home is so critically important right now. Moving forwards though, absolutely, as we get this first wave under control, the absolute key is to having sensitive systems to detect any new cases and then to do rigorous contact tracing around those cases.
Thank you. And I have another question about long-term care facilities. And is the federal government considering any measures or regulations or federal oversight to ensure long-term care facilities are protected from this or any further pandemic?
So, as everybody has seen, some of the key drivers of the outbreaks in Canada are the long-term care facilities. So, together with all chief medical officers, this is probably one of the top areas of collaboration right now. I think you have seen Dr. Henry and others in their jurisdiction enacting some very important policies and measures, not only from the perspective of really key infection control measures, but also measures to reduce the amount of movement of staff between facilities. That's actually very important. And also what kind of support people need to ensure that that happens. So right now at the Special Advisory Committee, our key piece of work is looking at the guidance related to how to do infection prevention and control in this population. Really, really vital. And so I think from the federal side right now, at least from the Public Health Agency side, we're providing the federal guidance on the next set of measures.
Thank you.
Hi, Dr. Tam. My first question is for you. I'd just like to follow up on what you're saying there about this federal guidance for new measures for long-term care home, if I'm following. I know in BC, this type of movement that you're saying the measures there were to prevent workers from working at one facility and then working at another facility. Are part of these measures going to recommend to Premier Ford and Premier Legault in Quebec as well to follow those same measures that were put in BC?
So this is expert guidance, but also it will essentially be a consensus position from the Special Advisory Committee, and we provide that advice across Canada. So, and just stay tuned because we're actively working on this right now.
And my next question would be for Minister Duclos as well as Dr. Tam. There was a release that came out that the RCMP is now going to start enforcing the Quarantine Act as well, following up on some of the compliance measures that public health is doing now. Some of these measures would also include being able to take people into custody rather than just a court summons. So why is this change in policy necessary to get the RCMP involved? Is it because there were so many people that were already violating the Quarantine Act? Why are we stepping up these measures?
Thank you. I'll start, and then Dr. Tam might want to add. We all know that making sure that this situation is resolved as quickly and as safely as possible requires the cooperation and the work of everyone. And that's why we have made it clear over the last few weeks and days that we expect everyone, and especially every traveler coming from outside of Canada, inside of Canada, to follow the strict self-isolation, not only guidelines, but not only recommendations and guidelines, but these are requirements. People must self-isolate for 14 days. We understand that most and a large majority of Canadian travelers understand and apply those measures. But we also are mindful that there are a few that might require perhaps more serious care in particular, defined in a particular way. And that's why we are working with security agencies and police forces across Canada to make sure that when that is needed, and we understand this is rarely needed, the collaborative engagement of all police forces, including the RCMP, may be required and may be implemented. But Dr. Tam, you might have a public safety perspective on that as well.
Yes, I think it's really to give us the range of tools that might be needed. Of course, we're asking everyone that when you're issued a order from the federal government on the Quarantine Act, we expect that to be followed. We are contacting people, and for the majority of the time, you can find them in their rightful place of self-isolation and quarantine. But this is just the range of measures then our peace officers who are designated under the Quarantine Act can then take necessary measures. And the Quarantine Act has very powerful penalties. But what you don't want is to just apply the really high end of those measures. You want to sort of make sure, fair warnings given, education is given, and calibrate what you may want to apply to a particular person not following the Quarantine Act in a sort of calibrated way, if you like. So I think it is to look at the range of instruments and how you implement this that the RCMP is currently looking at.
Thank you, Dr. Tam. We'll now turn back to the phone. Operator.
Thank you. Merci. Our next question, notre prochaine question is from Brian Platt with the National Post. Please go ahead. À vous la parole.
Hi, I've got a question for Dr. Tam. I wanted to ask again about contact tracing. We know that it's a very resource-intensive process requiring basically a small army of people to make phone calls and so on. When you talk to your provincial counterparts, what's your sense of how close we are to having the capacity to do this properly? Do we have enough people in place, or are we getting there?
Yes, this is a topic of ongoing situational update, if you like, on an ongoing basis. So what I've been hearing is that people do have the human resource that they need, but we're also there to support if needed in terms of surge. Of course, we've been monitoring and forecasting, say, if there's increase in cases, which then means increase in contacts, we're there to support the surge if needed. So you may have heard that we are looking at rosters of course, students, retired public health or medical workers. Provinces doing that already. So you will see some jurisdictions have already put in that surge, and others, if they should require it and we can help in any way, we have that cadre of surge being pulled together as well.
The other thing people talk about with contact tracing is the possibility of technology, including cell phone location data. What kind of discussions are you having about that right now, including whether it's possible to do this without violating privacy laws?
I think that is an area of great interest to every jurisdiction. There are many, many innovators with lots of different ideas. So we are pulling together a group amongst the provinces and territories to gauge interest. And I do believe there's a significant amount of interest, but there is a lot of innovators. And we need to look at each of those innovations, as you say, in particular, as it pertains to things like privacy. I do think that there's different ranges of applications. Some are, of course, for contact tracing, but others are more to sort of giving people alerts so that they are nudged to do the right thing in terms of social distancing. So there's a range of different innovation, but we are together evaluating some of these.
Thank you, Doctor. Next question, please.
Thank you. Merci. Our next question, notre prochaine question is from Catherine Tooney with CBC News. Please go ahead. À vous la parole.
Hi, thanks for taking our questions on this Good Friday. I think this is a question for Dr. Tam. Briefing notes from February show that health officials were aware of market pressures for getting PPEs. Just wondering, was the push to get crucial medical supplies on the global market in February adequate, considering officials were still advising the government that the risk of the spread here was low?
So just to situate this, I think from about the day one that we heard about outbreak of an unusual outbreak in Wuhan, we started preparing the health response. So absolutely every aspect of this were looked at, but of course at the beginning there were fewer cases. This is a completely novel virus. We did not know necessarily where it was going, but we were tracking it very closely, and our risk assessments, but also our response evolved, of course, as we learn more about the virus every day, if not every hour. So those underwent evolution as we went along. And I think it is as the world came to respond to this particular situation with some very unprecedented measures, including a lot of the border measures that restricted flights, etc., and the major global demand for these PPEs. Of course, we've been escalating every single aspect of that response as rapidly as possible. So as you've heard, every single option was examined. So I think that, again, I just want to remind people that we haven't been in this for very long, and every government department actually escalated, and different levels of government really, really fast. And we're learning, we're humbled by this virus, and we're learning as every single day. But I think PPE was probably one of the top priority issues in our collective response and how we're going to deal with it. So I think absolutely.
I would love to follow up on that, but I do have to ask another question for colleagues who are chasing the low testing rate in Ontario, and they're wondering, what is the national strategy to coordinate testing across the country, or are you going to just leave it to the provinces?
There's a really huge collaborative response from the laboratories, from day one, in getting the initial novel testing actually in place in Canada. And now, of course, improving our range of testing capabilities, not just a single type of test, but more than one. But also, as everybody appreciated, just as there was a global demand for things like personal protective equipment, there was also an equal demand on laboratory reagents, swabs, and everything. So all stops were pulled out for doing that as well. But every laboratory, every public health lab have been engaged, and we're there to support each other. So if there's a need, and there's a need for surge, a need for further support to any jurisdiction, we're all there to help.
Thank you, Doctor. We'll take one question in the room and then one last question on the phone.
Hi, Dr. Tam. I have a question about the testing. You've said a number of times, and the Prime Minister said a number of times, that testing is the #1 way to beat this. Ontario does have a smaller amount of testing that's being done every day. They did change the requirements yesterday, or the criteria, in order to get a test, but it still is applying mostly to healthcare workers and people who are going into those higher risk settings. How long do you think it'll be until we have the capability, the equipment necessary, or just the ability to test every single person who needs one right now?
Well, I think we did achieve consensus at the Special Advisory Committee on the key priority groups that must be tested, because that's the driver of the epidemic. And so I think those priority groups, absolutely. We want to be able to cover all of those really quickly because whatever we do in those kind of settings will determine the trajectory of this epidemic. So I think, every single day we look at our capacity and how we improve it, including the ability to look at domestic production of testing capabilities. So all of that are on the go. It is very dynamic every single day. So we look at our supplies and we look at how we support jurisdictions every single day. So, as the number of cases come down, of course, on the other side of the curve, the demand will also be lower. So it's a very dynamic process. So, but all I can say is every jurisdiction is trying really hard to get their testing platforms up and running. Some of them might actually be changing their platforms at the same time. So here's the sort of different dynamics at play. But I do believe that our capacity will just keep increasing.
Thank you, Doctor. One last question on the phone, operator.
Thank you. Merci. Our last question, notre dernière question nous vient de Béatrice Britneff with Global News. Please go ahead. À vous la parole.
Hi, yes, my question is for Minister Qualtrough, again on the CERB application. I want to confirm that the government will be clawing back or recouping money from applicants who do get the funding but aren't eligible, and when that is going to happen.
Well, thank you for the important question. So CRA and Service Canada are going to be following up with people who got 2 payments of $2,000. Now, that's not the people who got more than they thought perhaps they should have. Only people who see a double payment of $2,000 will be contacted. And as I said in my remarks, you don't have to call us, we're going to call you. The idea being that we want to make sure overall people don't get more than $8,000 during the 16 weeks. So it won't necessarily be a clawback situation. It might be you can't apply for more than the $8,000. We're going to work with Canadians. We're working with CRA. We're still getting a handle on how many of these payments, double payments, actually happen, which were completely driven by confusion by applicants of the need to apply once or twice. And we're going to make very sure that it doesn't produce any hardship financial on people. And it's why my message is to make sure you budget, because over the course of 16 weeks, you're only entitled to $8,000 total.
Beatrice, follow up.
Yes, specifically on applicants though who don't meet the eligibility criteria but apply anyway and receive funding. When are you going to be verifying or conducting the verification process and trying to get that money back?
I would say that that's a bit of a work in progress, and that's not to waffle, but as the situation evolves, and quite frankly, I think the question presumes a little bit of intent on the part of Canadians that just isn't there. We're asking people to truthfully state if they stopped working because of COVID, and people are more concerned about being overly honest in Canada than, our fraud levels just aren't high, and we know this from other government programs. But absolutely, over the course of whether it's weeks or months to follow, we will definitely verify income, verify eligibility, and it will be offset at least during tax time, if not before.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. That's it for today. Thank you, everyone.
Briefing from federal cabinet ministers and public health officials. I'll just pick up maybe on the last point there by Minister Qualtrough about the CERB, because I know some of you have received different kinds of payments. The minister there making it very clear that if you've received 2 payments of the CERB, so a total of $4,000, you will need to budget that, because you are not going to get more than the maximum, which is $8,000 over the 16 weeks, over 4 weeks for now anyway. I know there's also people, though, that got their employment insurance and then their CERB. In that case, we've previously heard from ministers that is okay. You got the EI from before and you're getting the CERB going forward. So hard to figure out, I know, for many people, but I think the message there from the minister is budget what you've got, because there will be a limit, at least for now, on what the CERB is. And I'll bring in my colleague, host of Power and Politics, Vashi Kapelis. You're sort of my host too. Anything else there that you thought was of interest?
Yeah, and just quickly picking up on what you said around, because we have heard from a lot of people who were confused about, well, did I get too much money or whatever? I think that point on budgeting, so the most you're going to get from the CERB over the course of 4 months, I think she said would be $8,000, right? So that's budget within that, thinking about the next 4 months, but also that if there are doubled up payments or something went wrong, expect a call from the government. You don't have to reach out to them. They will get in touch with you. That's also, I think, because again, a number of people have reached out. The other thing I'll touch on, because we are anticipating Ontario Premier Doug Ford's press conference any minute now, is testing in Ontario, and the number of questions directed particularly at Dr. Theresa Tam about what role the federal government should be playing in sort of mandating standards when it comes to testing. Two issues that we've seen in Ontario. First of all, they have the capacity now. They've ramped up the capacity to process tests. They should be doing 13,000 tests a day. They're not. They're falling well short of that, 4,000, 2,000 some days previously this week. There's a couple of reasons. We're hearing that swabs aren't available at certain assessment centers. We're hearing that things were taking a long time before. There's a host of different reasons. The criteria was too narrow. It was widened a bit yesterday. Is there a role for the federal government in saying, okay, here's the criteria and here's the amount per capita you need to be testing. We will work with you to get those supplies. The federal government is saying that they're supportive. They're supporting the provinces in those efforts. But I think there are more questions for Dr. Tam, for Minister Hadu, about maybe going forward what kind of role the federal government has to play in this, because there really are discrepancies between provinces in their ability to test.
Yeah, and the testing is key to trying to get things under control. We've seen that in, the Prime Minister mentioned British Columbia, Alberta, Quebec is catching up, but Ontario continues to be a problem. So we will hear more from Premier Ford shortly. Thank you for your help, as always, Vashi. Vashi will be back at 5 Eastern for her show, Power and Politics, where she will have all the latest on everything, as she always does. Appreciate it. So I will leave you with this. Tomorrow, the House of Commons will be sitting just after noon tomorrow, noon Eastern. The Prime Minister will not give his daily briefing at 11:15 because he will address parliamentarians in a reduced way inside the House of Commons. We are expecting about 20 parliamentarians to be there tomorrow, including the Leader of the Official Opposition, Andrew Scheer, and NDP Leader Jagmeet Singh. The Senate is set to meet later in the afternoon tomorrow in hopes that this wage subsidy legislation can get passed very quickly. But we know that there have been ongoing problems in terms of the negotiation of how that will happen. Obviously, a critical measure so many businesses and employers and employees are waiting for in the weeks ahead. I am Rosemary Barton. I'm going to sign off for now. I'll see you back here tomorrow for the House of Commons. But for now, I will let Andrew Nichols, my friend, continue with our ongoing coverage of the COVID-19 pandemic. Remember to stay safe. Thank you for watching. I'll see you back here tomorrow.